And so really designing and implementing protocols in electronic systems, it really, I think, can optimize biomarker testing for non-small cell lung cancer patients. And I did get board certified in clinical informatics because I really wanted to raise awareness of that being an actual subspecialty in the practice of medicine. It is. It takes up a significant amount of my time as a molecular pathologist and medical director, building a program and sustaining a program, right, and moving it forward. So it requires collaboration across healthcare and information technology professionals to, and I showed you this by that example, I guess in the last hour, analyzing your system, right? And then designing protocols that fit into that system and take into account the practices in that system, implementing a protocol that makes sense based on what on your background work. And then I think what we need to call ourselves to the table to do is evaluate the information and communication systems that enhance individual and population health outcomes, because I think we're doing it because we have the hypothesis it's going to improve patient care and strengthen that clinician-patient relationship. And I think there's a lot of room out there for publishing your data around the improvements in patient care related to your improvements in electronic health communications, and in terms of the clinician satisfaction with the laboratory around when you implement one of these protocols, like, are they satisfied? I haven't published this and I haven't collected the data, but I think it's fair to say our clinicians are satisfied with the improvements that we've made. So successfully, in kind of summarizing a lot of this, successfully leveraging information systems for continuous quality improvement in the management of non-small cell lung cancer, it does require organizational support of a champion or a group of champions who understand not only the clinical care related to non-small cell lung cancer, but the laboratory practice around those specimens and the value of clinical informatics. There does have to be a significant background investigation of systems and processes before you go mucking around, or else I think you'll irritate groups in your organization. Early stakeholder engagement is key, right? Make it easy to do the right thing and involve people early. And there has to be ongoing advocacy for resources to build information systems that are supportive of biomarker testing. And also, I still kind of am guilty of this sometimes because we're just trying to build and sustain and keep our heads above water, especially post-pandemic and where healthcare is at the current moment. But I think we really need to be responsible for setting upfront achievable and measurable goals, and then keeping on task, looking at our quality improvement and publishing that. Because I think the value of all of this is currently under-recognized, and sometimes leadership, they won't pay attention unless you can provide them something in black and white around the return on investment. So test order build impacts biomarker analysis and clinical follow-up. I hope the short example I gave you today illustrated that. Informed design of care pathways that are supportive beyond the test, like the reflex pathway that we implemented. You're able to optimize tissue management and really employ tissue stewardship to be successful in your testing for the patients. Time to testing is much improved. Total non-informed care, I showed you that, it plummets, right? We went from 60% non-informed to just about 5% non-informed. And then I think most importantly, what we did with this protocol was we were able to ensure equitable access. It doesn't matter what your background knowledge is as a patient coming into the organization in terms of like, well, what's modern cancer care all about, right? You have enough to worry about if you're in that situation. And so if you implement something like this, you actually ensure equitable access, regardless of anyone's background knowledge coming in, regardless of anyone remembering to do the right thing, right? You make it easy to do the right thing.